am Kiana, and today I'm going to talk about radioisotopes, and most likely I want to talk about the beneficial uses of radioisotopes in medicine, chemistry, and industry. And then I'm going to talk about the role of Canada in radioisotopes and the risks that radioisotopes can make. What are isotopes? Isotopes are the atoms of the same element with different number of neutrons but the same number of protons in their nucleus. Do you know what holds protons and neutrons inside the nucleus? Well, there are a lot of numbers of protons inside the nucleus, and they like to repel each other. But there is some sort of energy called binding energy that holds neutrons and protons inside the nucleus. I'm sure you all hear about non-stable atom during your chemistry classes, but do you know what does it actually mean? Well, I'll tell you right now. Most of the elements like to have the same number of protons and neutrons inside their nucleus, so they would be stable. The binding that holds the neutrons and protons inside the nucleus is really strong in stable atoms. However, an additional neutron may upset the binding energy, so it causes the atom to become unstable. What is radioactivity? We all know that atoms with unstable nuclei are constantly changing as a result of the imbalanced energy within the nucleus. A radioactive atom is when the nucleus of an atom loses a neutron, so it gives off energy. Radioactivity is the release of energy and matter due to the change in the nucleus of an atom. Now that we talked about isotopes and radioactivity, we can easily understand what are radioisotopes. Radioisotopes are isotopes that are unstable, and they release their energy by emitting radiation in the form of alpha, beta, and gamma rays. Have you heard of radioactivity decay? As an unstable atom tries to reach a stable form, energy and matter are released from the nucleus. This spontaneous change in the nucleus is called radioactivity decay. Radioactive isotopes are either made by man or naturally in nature. They are used widely in the form of gamma rays, beta particles, and neutrons in science and industry to achieve desirable changes. They have many beneficial uses in medical diagnosis and treatment and agriculture. Radiation doses control offending organisms, including harmful bacteria and cancer cells, and sterilize insects. It is also beneficial in chemistry. Local energy deposition can also motivate chemical reaction and modify the structure of plastics and semiconductors. It also has so many other beneficial uses in many other fields. I'm really interested in biology, so I'm going to start with the beneficial uses of isotopes in medicine. Radioisotopes have become very important in the practice of modern medicine for both diagnosis and treatment. In radiation therapy, an effort is made to treat or cure disease with radiation. However, the diagnostic use of radioisotopes is for obtaining information about the state of the patient's health. We all know that cancer is one of the most dangerous problems that can affect people. Some types of cancer are sensitive to radiation therapy. We can destroy cancer cells before too much damage is done to healthy tissue by radiation therapy. One of the characteristics of cancer cells is that they reproduce rapidly. Radiation is most lethal to rapidly reproducing cells. Therefore, this characteristic of cancer cells allows the radiation therapy to be successful. Radiation is carefully aimed at cancerous tissue while minimizing the exposure of normal cells. If the destructive effects of the radiation could kill cancer cells, then the malignancy halted. Because the doses of radiation that are needed to destroy cancer cells are high, patients undergoing radiation therapy often get sick. Some of the early symptoms of radiation sickness are nausea and vomiting. Radiation can also increase sentimentalism to infection by interrupting with white blood cells replenishment. The next part is diagnostic uses of radioisotopes. Radioisotopes are also used for diagnostic purposes in order to provide information about type or extent of annulus. For example, radioactive iodine-131 is used to determine size, shape, and activity of the thyroid gland, as well as to treat cancer located in this gland and to control a hyperactive thyroid. Different doses are used for different purposes. For example, small doses are used for diagnostic purposes, while large doses are used for treatment of thyroid cancer. How can we show the location of tumors or other abnormalities in the thyroid? Well, first of all, the patient has to drink a solution of potassium iodide that includes iodine-131 so the body can concentrate iodine in the thyroid. A detector showing the differential uptake of the isotope is used in diagnosis. In the result, photoscan can pinpoint the location of tumors or other abnormalities in the thyroid. However, for cancer treatment, we use radiation of large doses of iodine-131 to kill the thyroid cancer cells that has concentrated radioisotopes. This occurs even in thyroid cancer cells that have spread to other parts of the body. Now I'm going to talk about radiation chemistry, and then I'm going to tell you the beneficial uses of radioisotopes in chemistry. The effect of high-energy radiation on matter, emphasizing on chemical reaction, is radiation chemistry. Radiation has been used and studied in laboratories, but has terminated because of cost and safety. As catalysts, gamma rays have been found to be superior in many cases in chemicals, to the application of ultraviolet light and to electron bombardment. Now I'm going to talk about the beneficial uses of radioisotopes in industry. Radioisotopes are used widely as tracers in physical, chemical, and biological systems by scientists. Isotopes of a given element, whether radioactive or not, behave nearly identically in physical and chemical processes. It is easy to trace the movement of radioactive isotopes because we can easily detect them through their decay products. One of the uses of radioisotopes in industry is detecting leaks in underground pipes. We could locate the leak by using the radioactive material if there is a leak in the pipe which is buried beneath a concrete floor. Well, we could add a small amount of radioactive material to liquid poured into the drain. Then trace the flow of the liquid with Geiger counter, which is an instrument to detect radioactivity. Another way to detect the leak is by digging up extensive areas of the floor. Once we locate the leak, only a small area of the floor would have to be dug up to repair the leak. For example, a compound iodine with a mass number of 131 and an atomic number of 53 is usually employed in these situations. Now I'm going to talk about the beneficial uses of radioisotopes in agriculture. Do you like banana? Yeah, it's so good. But it's also too bad, because Emily Frinson, a Belgian plant pathologist, announced in 2003 that bananas might go extinct in 10 years because of the lack of their disease resistance. Do you have any idea about how we can get rid of this awful problem? Well, I do. Producing heritable genetic alteration, called mutation, is one of the most successful agricultural techniques. If we expose seeds or other parts of plants to neutrons or gamma rays, we could increase the likelihood of genetic mutations. At first, you might think This procedure is not the most promising of effort, but you should know the genetic variability is extremely vital, not only because of improving their varieties, but also to protect species from extinction like banana. This part is about Canada's role in radioisotopes. The Canadian government owned a nuclear reactor at Chalk River, Ontario, and it was back in service in December 2007. Chalk River produces medical isotopes for Canadian healthcare company MDS Nordion division, which is responsible for about 50% of world supply. The National Research Reactor, NRU, which makes more than 2/3 of global supply of radioisotopes used in cancer tests, was shut down in November 2007 for technical reasons, quickly triggering shortages. NRU provides medical isotopes for about 25 million diagnoses and treatments a year. Risks of using from different types of radioisotopes. Alpha emitter. Since the maximum alpha ray energies cannot penetrate the outer layers of skin under normal and safe experimental conditions, the external radiation hazard from alpha emitters is negligible. But because of the radioactivity of alpha emitters, there is considerable radiation hazard from it if absorbed within the body through the different ways, such as inhalation, ingestion, or extra. Radioisotope H3. The external radiation hazard from compound of H3 is significant like of alpha ray, because it can penetrate the outer layers of skin. However, because of low beta energies from H3, the radiation cannot be monitored directly, so special care is needed in order to keep the environment clean. Because of the surface contamination, regular monitoring by swab counting is important and essential to reduce risk of ingestion.